Good afternoon, folks. Now I have discussion B. We're discussing. I wrote a narrative on U.S. health spending affecting elderly care. So here we go with the presentation I made for you. Sit back and enjoy, please. Okay, here we go. On a cold morning in January, an older woman in Western Pennsylvania sat at her kitchen table with three envelopes in front of her: a hospital bill, a pharmacy receipt, and a property tax notice. She wasn't sure she could pay. She wasn't sick enough to be in the hospital anymore, but she wasn't well enough to be back at work. Her daughter had taken unpaid time off to help her recover. The bills weren't catastrophic, not by Washington standards, but they were enough to tilt a family already living close to the edge. Multiply that by millions of households, and you begin to understand how the nation's healthcare tab reached 5.7 trillion last year. It didn't happen because of one blockbuster drug or one expensive hospitalization. It happened because the system asks every family, every employer, every state budget to absorb just a little more each year. A little more of premiums, a little more for medications, a little more for care that arrives later and sicker because waste people wait too long to seek help. We talk about national health expenditures as if they were abstract, a line on a CMS chart, a share of GPD. But behind that 5.7 trillion are stories of people trying to stay healthy in a system that too often confuses spending with value. It's the nurses. It's the nurse working a double shift because her unit is short staffed. It's the rural hospital fighting to keep its doors open. It's the Medicaid director staring down a budget that grows faster than the state's economy. It's the older adult who falls, breaks a hip, and suddenly needs a level level of support no family can shoulder alone. The number is staggering, yes, but the real story is what it reveals. A country where healthcare has become both our largest industry and one of of our greatest sources of financial strain. A country where we spend more than any nation on earth. Yet too many people still struggle to get the care they need when they need it. And the question before us, the one that matters, is not simply why the number is so high, but whether we are getting what we think we're paying for. Okay, guys, that is your B. I'll be on for C shortly. Give me a little bit, and I'll be back on with you shortly. For now, Gator Wellness, take care, folks.